We're in Indianapolis at the Sports Cardiology Summit 2014, and I'm with Dr. Paul Thompson, who is the Chief of Cardiology and the Director of the Athlete's Heart Program at Hartford Hospital. And you were talking about some of the key studies in sports and exercise cardiology in this last year. It's been an interesting year, hasn't it?
It's been a very interesting year, but then, you know, when you get to my age, every year is interesting, isn't it? So I think there are a couple of studies that were very important this year. The thing that I think is the most, for me, kind of game-changing study is there was a study out of Hopkins from Dr. Cochrana's lab that looks at people with right ventricular cardiomyopathy. Now, there's a lot of variability in who with the genotype actually gets the phenotype of right ventricular cardiomyopathy. And so the question that they asked is, could environmental factors make a difference? And could one of those environmental factors be exercise and exercise training? Now, it's interesting because we've known for a long time that the right ventricle seems to be most vulnerable to exercise. Way back in 1990, Pam Douglas looked at people participating in the Hawaiian Ironman and was able to show that the right ventricle tended to dilate and to not squeeze as well after that prolonged exercise. So the right ventricle is vulnerable. So what Dr. Cochrana and his group did is they took a bunch of people, 83 I think, who had the genes for right ventricular cardiomyopathy, and they asked them about their exercise history. Those people who were most physically active, and especially those who were endurance athletes, tended to present earlier, tended to have a more aggressive, and it wasn't just a trend, it was more statistically significant. They had earlier disease, and they seemed to have worse disease. So the idea may be that if you're born with this vulnerability for the thin-walled right ventricle to be injured by exercise, and if you're an exerciser, you may be able to provoke the right ventricular cardiomyopathy earlier. So I think that's kind of a thought-changing idea, because it may be that exercise is great for the most of us, but there's some groups that may be vulnerable. So let's take some examples. Maybe hypertrophic cardiomyopathy. Now, why would I say that? Because one of the things that happens with exercise training is you increase the wall thickness. So if you had the genes for hypertrophic cardiomyopathy, but a mild form, could you make it worse with exercise training? What about the long QT syndrome? Because one of the things that happens with exercise training is you get a slower heart rate, you get bradycardia. And what does that do? It tends to lengthen the QT interval. So I think this is an interesting idea that Cochrana's group has kind of invented or brought up. Now, don't get me wrong. I don't want people to think that exercise is a bad thing. What we have in the United States is too many people that don't get enough exercise. What we have is plenty and plenty of studies that show that endurance athletes live longer. But among those groups of endurance athletes that live longer, are there subgroups that may actually get some deleterious effects of exercise? It's really quite a new idea, and I think it's very important.
What would the clinical implication be over a period of time? In other words, not today, there's probably no clinical implication, but in the future, how can we maybe detect these people?
So that's a great question. Today there are some clinical indications, because one of the groups that I and other folks are most emphatic that they drop off their exercise level because of these studies is the group who have right ventricular cardiomyopathy or have the predisposition for right ventricular cardiomyopathy. Going forward, what we may actually do is kind of identify these people by genotyping them to see who's going to benefit and who's going to not benefit from exercise training. Now, right now, the evidence is that most people will benefit, but is that true? We need to look at that possibility.
And what about familial exposure? If you know their family history, would that change your recommendation?
It may in the future. As you say, what's coming in the future? Right now, it would be a mistake to make these people cardiac cripples or make all of them cardiac cripples. Right. But for those folks with the genes for right ventricular cardiomyopathy, it may be a good thing to kind of get them to tone down their exercise training. And there may be other groups that we'll identify over time.
What else is new and exciting?
I think one of the things that's exciting is the idea that athletes may be more vulnerable to atrial fibrillation. We reviewed this back in 2009 and found about 6 studies that suggested that those people who are endurance athletes were more likely to develop atrial fibrillation. There have been a bunch of studies since that time. In the past year, the Vasaloppet ski race, which is a 56-mile cross-country ski race in Scandinavia, took a look at all their athletes, and what they found is that those athletes who tended to be the best skiers and had participated in the most races had a higher incidence of being admitted with atrial fibrillation. So I think there's increasing amounts of information that athletes may develop atrial fibrillation more than others. Now, why would that happen? Well, a couple of reasons. One is that exercise training increases vagal tone. Vagal tone slows the heart, maybe gives you this thing called electrical dispersion, so you're more likely to get the atrial fibrillation. There's also the catecholamines from exercise. So maybe the catecholamines when you're actually exercising causes that. Left atria are bigger in athletes. In fact, in real elite athletes, about 20% of them have a left atrial size that's bigger than the normal size. And we know that left atrial size is a big contributor to atrial fibrillation. So all these possibilities may make it so that athletes are more likely to have atrial fibrillation. Now, is this proven? No, it's not proven. There are no double-blind controlled trials that's sort of gold standard, but there's increasing amounts of evidence raising this possibility, and it's consistent with some of the physiology.
Are we talking about multiple marathons every year, or is one marathon over the course, a year for 25 years, is that enough to raise the risk?
So it's nice of you to ask me questions I can't answer, because the simple fact of the matter is that this is really kind of, these are new things that came up in the last 2 years. So we don't know. It's almost certainly going to be an interaction with how much exercise you do, I would think. But it's probably also going to be an interaction with other things. How much do you drink? What other things do you have that could make you at risk for atrial fibrillation? Right now, we can't say. All we can say is there's suggestive evidence that's becoming more suggestive that those people who are endurance athletes are more likely to develop atrial fibrillation than people who aren't.
Now, there was also some good news, a couple of good papers that you talked about.
There's a lot of good news. So even though there's some evidence or some studies that suggest there may be deleterious effects of too much exercise, there's also a lot of studies that show that those people who are physically active live longer. Now, I think that one of the things that people will be most interested in knowing is that there's this large study from the Cooper Aerobics Institute. And what they did is look at about 56,000 dudes and dudettes, so a lot of people, okay? And what they found is that those people that exercised even as little as 10 minutes a day had lower rates of death than those who did nothing. It didn't matter how fast you did it. Even if you were as slow as 10 minutes per mile jogging, you had lower rates. 1 to 2 times a week, you had lower rates of death than if you did it not at all. So I think the point that we ought to get across to patients is do something, like Nike, just do it. It doesn't matter how much you do, as much that you do something. It appears you get the most benefit from going from being a total couch potato to being less than a total couch potato, but not necessarily a great endurance athlete.
And that study was in JACC, if I remember right. Chip Levy was one of the, and Stephen Blair.
A shameless plug for your organization.
Absolutely.
Yeah, totally.
And the last thing I wanted to ask is, coming up in the future, we've got a couple of papers coming out in the months ahead that could be very interesting. 2 from Circulation, one that will probably end up hopefully coming from the Bethesda conference report updates. Can you just talk about there's the one you just mentioned on ECG, guidelines from AHA?
The American Heart Association, ACC, are going to be coming out with their new guidelines about ECG screening. Now, this is not going to address just electrocardiographic screening in athletes. It's going to address electrocardiographic screening in young individuals in general, and whether that should be kind of a mandatory recommendation. And so the recommendation is going to be that it's not mandatory, but it's something that you can do in certain situations if you think it would be appropriate.
And there's also some guidance in terms of genetic testing coming also, I believe, from Circulation.
Yes, could be. I'm not involved with that, so I can't give you an embargo-breaking news story on that.
But I can tell you that you do have some connection with the Bethesda conference update. I wasn't aware that it was being updated. I think it's a tremendous idea. It may be months before we see it, but just to know that that's coming.
Yes, the Bethesda guidelines are recommendations for who should be excluded from competitive athletics. Those started in 1984, and they've been updated several times, but now they're being updated again. That should be out somewhere, I would think, early 2015, but not 2014.
And it's been, I think 2005 was the last time that we had those Bethesda conference reports on sports cardiology. So please check out in the weeks and months ahead as we take a look at more and more of these guidelines that keep coming out, one after the other. From CardioSource World News, I'm Executive Editor Rick McGuire.